We are joined by Dr. Rich Sagall. He is the president of Needymeds.org, based right here in Gloucester, though it does serve the entire country. Thanks for joining us, Rich.
My pleasure. Thanks for asking me.
And right up the top, can you explain to folks what exactly is Needymeds?
Sure. Needymeds is an information source. We have data on over 30,000 different programs that help people who are having trouble with healthcare costs. So we do not provide direct assistance. We provide information on programs that will provide the assistance.
And Rich, I will say this site is so extensive. I have seen that you offer information about finding free and low-cost health clinics, about medical transportation, diagnosis-based assistance. But what I really want to ask you about next is the Needymeds drug discount card.
Sure. This is a free card that anyone can use, and it offers savings of up to 80% off the cash price prescription drugs and pet prescriptions you purchase at a pharmacy.
So what are the parameters of that? Can the whole family use it? What if you're not a US citizen? What if you have insurance? So give us the breakdown.
Anyone can use the card. There's no limitations based upon residency, insurance status, etc. However, you cannot combine the card with insurance or state or federal programs. So if you're getting a prescription filled and you have health insurance and the card offers a better price, you can not use your insurance and use the card instead, but you can't combine them. It will not help with a co-payment. And that's true of all the drug discount cards on the market.
Okay, so, and again, one card for a whole family, anyone in the family can use it, or a friend could use it, is that right?
That's correct. There's no tracking by individual. There's lots of cards out there, and we differ in a couple of ways. One is there's no registration, sign up, or enrollment. You can just get a card, you can download it from the website, you can contact us and we'll mail you one. And the second thing that differentiates us is we gather no user identifiable information. So we do not know who's using the card. Other cards may gather that information and use it for marketing purposes. We don't do that because we don't even get the information. Most of the time, we never know who's using the card.
And I know you said this, but I just want to repeat it. It's also available for pet medications that one can find in a pharmacy, right?
Right. So if your pet is on insulin or anti-inflammatories that humans take, it has to be a human drug also. You can get it at the pharmacy, and it may be a lot cheaper than the vet. You'd have to price it out and see.
So Rich, can you talk for a bit about the prescription assistance programs?
Sure. The prescription assistance programs, or PAPs as we call them, are programs funded by the pharmaceutical manufacturers. These are programs designed for people who have no insurance or have poor insurance and cannot afford the price of their medications. There are eligibility requirements which are based upon income, diagnosis, medication, insurance status. If you meet the qualifications, you can get the medications for free. So they give away billions of dollars worth of drugs every year to people who could not afford them otherwise.
And again, the staff there at Needymeds can help people sort through these programs, right?
Definitely. All the information is on our website, which is www.needymeds.org. We also have a toll-free helpline, 800-503-6897, and people can call that Monday through Friday, 8:30 to 5. And one of our trained staff people will walk you through the process, help you find the programs that would benefit you, give you the phone numbers to call or the addresses or the website, and then it's up to you. We provide information, but individuals have to apply to the programs.
So Rich, the health concern of the last 8 months is of course the virus. So in what ways does the Needymeds site assist people suffering either specifically from COVID-19 or the impact of the virus?
Well, we do have a compendium of programs specifically for COVID-19 and people who are experiencing difficulties due to that infection. And you can find that link on our homepage. But many of the programs will help people whether they have COVID or some other problem. So people need to look at all the other resources that you mentioned, particularly the diagnosis-based assistance area, because there are lots of programs that will just help people who are experiencing financial hardships, no matter what the diagnosis is.
Yeah, you have quite an extensive list of programs that can help people economically through all this.
Right. All the programs that we list have to have some financial aspect to them. So although there are many good programs that provide emotional support, support groups, education, et cetera, we tend to stay away from that because we don't have the capacity to evaluate them. But all the programs that we list, again, help financially. It may be providing diabetic supplies or incontinence supplies, mobility supplies, medically necessary transportation, housing, et cetera. So we really encourage people to look and to come back regularly because the programs change. Their eligibility requirements change. So medication that's not covered today may be covered next month.
Oh, so Rich, if people want to learn more about Needymeds, how can they do that? I know there's the phone number and the website, right?
Right, that's the way to do it. All the information we have is on the website. There's no information that we have that's not there. We update the data every day, every night. We repopulate our website, make changes, make additions. We're finding new programs every day.
And even though you're a national organization, you're based in Gloucester, do you work with other .orgs?
We work with a number of organizations. Some of them are local, some of them are national. But being in lovely Gloucester is just coincidence. My wife and I decided to move here from Philadelphia, so that's where Needymeds is based now, here in Gloucester.
Cool.
Great. Well, thank you for all the work you do. This is such an important resource for anyone who is suffering at all, or if they have a relative who is has health issues, or even if you're in good health. And I think that drug prescription card could help out.
It can. It helps lots of people. And I want to mention one other thing, if I may, which is even though we're called Needymeds, we help many people who are not, quote, needy. There are many programs that will help families of four that may make $80,000 or $90,000 but don't have health insurance. So we encourage everyone to look if medication or healthcare costs are a problem because there may be available help.
Fantastic.
It's a great resource.
Yeah. Dr. Rich Sagall from Needymeds, thanks so much for your time. Have a great holiday season, and we would love to catch up with you on the other side, especially as we start to see the release of the vaccination and how the populace sort of reads and reacts to that.
Happy to talk to you anytime. Thank you.
Yeah, I think the vaccination will be a really good conversation to have with you. So we look forward to that.
Anytime.